Okay, everyone. So we're just going to be starting the first recording session for this project. So I will start off again. We'll give you the case STEM learner, and then we'll give you a 1 minute time just to prepare for the case. So just to confirm, learner, you have the VRR slides open?
Yep.
Perfect. Perfect. Okay, cool. So your preamble is as follows. EMS has just brought a newborn baby that they found delivered in the hospital parking lot. The mother was en route to L&D, but then precipitously delivered while in the hospital parking lot. The mother is stable and is being treated by the obstetrics team and is available for questioning. An ICU is attending another delivery. So as the emergency physician on duty and pediatrician on duty, you're responsible for caring for this infant. The newborn is flat, cyanotic, and not breathing. I've also populated the STEM in the chat in case you need. So we have a minute to prepare before beginning the case. Okay, so the case is beginning. I'll be available to help with your resuscitation.
Okay, perfect. So my name's Dr. Mirza. I'll be leading this. Can I get the baby under the warmers and can we turn the warmer on?
Sure.
I believe it is okay. And
Warmers
then
on.
I'm gonna get the T-piece inflating, the flow inflating bag on the baby, and we're gonna start PPV. We'd like to give one breath every 2 to 3 seconds. And
Mhm.
so while we're doing that, we'll also get our cardiac our monitors on. Uh, and and is am I getting good chest rise?
Yep, you are getting a chest rise. If you want to
Okay.
see the infant, the patient appears on slide number 5.
Uh, okay. So the infant appears to be like cyanotic and dusky and limp and not responsive.
Mhm.
Yep. And back to slide 2 or
Yep.
yep, perfect. And I'm just gonna set my PEEP here on my uh, uh, T-piece to 5, and I'm gonna make sure that my inspiratory pressure is 20.
Mhm.
I can't seem to find it there. Okay, and I'm looking at my vitals now, seeing a heart rate of 60, oxygen 55, pressure. Okay. Um, and our temperature is 35.9. Um, and we have now been doing this for almost 30 seconds. So at the 30-second mark, we will reassess.
The timer is
Um,
indicated at the top of the screen above the incubator.
perfect. Okay. And I'm still getting good chest rise. Is that correct?
Correct. Yep.
Okay. Perfect. From here, I would now like to do I have any abnormal rhythms on the ECG or anything like that?
Nope, as shown up
No.
above.
Okay. So I think with this case, because we are continuing to have a heart rate below 100, um, in the presence of good chest rise and good ventilation at this moment, um, we should move on to an advanced airway and also start compressions. So we'll do the advanced airway first. So I'd like to get a my intubation supplies. So if I could
Mhm.
get a Miller 1 and also A 3.5 ET tube or three.
Perfect. So your Miller one is available here. And then you want a 3.52,
Yes, but or three. Three's
a
perfect.
three
Yeah.
two. Okay,
Yeah. And his
perfect.
mom available nearby?
Yes, mom's available for questioning. What questions do you
Okay.
want to ask?
And I just wanted to know what her gestation is and if there's anything identified in prenatal care for this child.
Yeah. Yeah, so mom is this is her second pregnancy. She has another child that's healthy. She's 32 years old. She had routine prenatal care with no major concerns on any of the visits. Due date was in 1 week's time. Prenatal serology was unremarkable and GBS status was negative. Upon delivery, there was some black tarry material that was kind of noted at
Mm,
birth, but that was really it. Mom was really trying to get to the L&D unit, but unfortunately delivered and couldn't get there on time.
okay. Perfect. And so because we are getting good ventilation at this time, I'm not going to go with my Mr. SOPA step. So mask readjustment, suctioning. Actually, can we actually suction first? I'll suction.
Yep. So suctioning is done.
Uh,
If you want
where
to see
is?
how the
Okay.
breathing is going, slide
Yep.
8 shows what it looks like with positive pressure ventilation on the child.
Okay. Okay. And if I go through those corrective steps of checking the mask seal, repositioning, suctioning, um, opening the airway, and then also increasing my pressure, so increase my peak to 7, and my
Mhm.
inspiratory to let's say 23. Does that make a difference?
No change.
No change. Okay. So I'm going to go ahead with the intubation at this time. So I have the patient positioned, and I'll use my Miller blade, identify the vocal cords and the vallecula, and lift the epiglottis and pass my tube through.
Mhm.
Was it successful?
So if you want to see the intubation, it is on slide number 9. Just hit the play to actually see what the video looks like.
Hmm. Okay. In that video, I can see that the tube is going through the vocal cords, and then we'll quickly attach it to our ventilator circuit. And can I get some capnography on that as well? Do we have color change?
You do have color change.
Okay, perfect. And are we seeing any change in vital signs from that?
So your vital signs are updating at this point.
Okay. Okay, perfect. And so at this point, I'd like to just start compressions on the child. So 1/3 of the AP diameter of the child's
Perfect.
thorax at a rate of 100 to 120 per minute. So we'll do that. And then um, I'd like if I have another person on hand here, to get a UVC line.
Perfect. So if you want to see the UVC, please proceed to slide 12 and walk me through the steps.
Alright, 20. Perfect. Okay. So for this, I would gather all my equipment. I would quickly sanitize and clean the area with chlorhexidine, and then make sure I have a clamp on. Grab my scalpel, and cut the umbilical stump, trying to create like a very clean edge, just straight across. Um, and sorry, prior to that, actually, I would put on some of my UVC tape, securing tape, I believe it's called tape. Um, and once that's in, and I have this picture here of what appears to be the umbilical stump. I'm going to take my UVC catheter and thread it through.
Please indicate which uh, orifice you did insert it in, which hole.
So I'm going to be going into one of these smaller ones. So I'm just going to double check because I'm actually doubting myself right now. Uh, Sorry, I'm going to be going into the bigger one of the two. Yeah. So I'm going to go into there, and then I'm going to flush and see if I can push fluid appropriately.
So you're able to flush some fluid through. You do see some pulsatile movements. Actually, no, you don't see any, sorry. You're actually able to get good blood flow that's coming up from there. So that's looking
Okay,
well. Okay,
great.
perfect. If you go back to slide one, you do have a
Yeah,
UVC that is in place at this point for access.
perfect. And now I'd like to just get point 2 or point oh 0.02, just 1 second. 0.02 per kilo of IV epinephrine.
Okay. Um,
And do we have a weight on the shot? I just realized I did not get that.
you do not.
Okay. Based off of Broslow, do we have any uh I think considering the child is term, we can go off a weight of 3 kilos as well.
Okay.
And if they appear appropriate for gestational age.
Okay.
So I'll be giving 0.06 milligrams of IV epi.
You know what concentration?
This will be of the zero point 0.1 milligrams per mil.
All right. I will be drawing that up for you guys.
And we'll be
So
doing this every 4 minutes.
perfect. So I have 0.06 milligrams of IV epinephrine, zero point 0.1 milligrams per milliliter. That's being administered at this point.
Perfect. And how are compressions going? Are we still getting 1/3 of the
Mhm.
chest and going at 100 to 120? And any changes with our I mean our PPV?
Your vitals are updating as
Okay,
follows.
perfect. Okay, so our heart rate has improved. It's to 100. So we can actually stop compressions at this moment, and we can transition to doing some CPAP
Mhm.
or just continuous pressure, no longer needing to deliver. Actually, we do have to give continuous breaths here. Sorry, because we're still intubated. Okay, so we will continue that. Um, and can I also give a IV fluid bolus? So can I give 30 mils of normal saline?
30 mils, normal saline. Perfect. I will
Yeah.
get that for you. Normal
Okay.
saline. So I'm giving 30 mils of normal saline through the UVC at this point.
Okay. And can I send off some blood work as well?
Mhm.
Can I get a CBC, gas, lactate, CRP, um, and a urea, creatinine, and glucose?
Sorry, CBC, gas, urea, creatinine, glucose. Anything else?
Yeah. And can I also send out blood culture
Okay,
and a CRP?
let's see. All right. That has all been collected at this point. So
Perfect. Okay.
patients at this point, color is now improved and is starting to make more of a respiratory effort and is grunting with some retractions at this point, but overall looks a bit more pink and is having some more muscle tone. Um, NICU will be coming in the next minute or two to help um, admit the patient. Any final things that you would like to do on the patient before final disposition?
Um, at this time, uh, Nothing at this time. I just realized my oxygen should have been higher for compressions, but um, we're okay for now.
Okay. All right. NSU arrives and takes the patient away. End of case.
Perfect.